With the improvement in quality of life, air conditioning is becoming a necessity for modern people. Living without air conditioners in hot and humid summer weather is very difficult. However, did you know that frequent exposure to air conditioning can lead to fatal diseases? Do you have a runny nose, fever, and sneeze? Are you tired, drowsy, and hard to concentrate? Do you have any headache symptoms? Does your body itch and your skin develop hives? Do you feel stuffy and dizzy? These symptoms may be related to air conditioning exposure. If these symptoms appear after frequent exposure to the air conditioner may be the cause. Please watch my video and prevent health damage related to air conditioning. Legionnaires' disease. Recently, in South Korea, there have been cases in which young people complain of blood in the sputum, muscle pain, high fever, shortness of breath, and dizziness after dancing at clubs. By the way, these symptoms are most likely Legionnaire's disease. Legionnaire's disease is an acute infectious disease caused by Legionella bacteria. They live in warm and contaminated water, such as air conditioner cooling towers, then enter the air conditioner and spread into the air. People are exposed to them through respiratory tracts. Pneumonia is the main symptom. Flu symptoms may also appear, and in severe cases, 1 or 2 out of 10 people may die. The elderly, immunocompromised, smokers, and people with lung disease are at risk. Suppose the club doesn't keep the air conditioner and cooling towers clean. In that case, it's possible that people can be infected, breathing Legionella bacteria spread in the air, while dancing and talking in the confined spaces inside the club. In addition, Legionella is also called veterans' disease because it was first known in the 1970s when members of the American Veterans Association developed a cluster pneumonia that killed 15% of patients. Cold urticaria. Long-time exposure to air conditioning set to very low can cause red swelling and itchy skin, called cold urticaria. This is because the skin is suddenly exposed to cold air and secretes substances that cause hives. By the way, moving to a warmer place can make it worse for a moment. Cold urticaria mainly occurs in autumn or winter when there is a significant daily temperature difference, but it can also be caused by exposure to air conditioning. For those sensitive to cold air, it is recommended to carry light clothes in summer and wear clothes in places with intense air conditioning. Sick building syndrome. Working in an air-conditioned building with poor ventilation for a long time can raise your risk of sick building syndrome. Symptoms include headaches, dry cough, dizziness and nausea, trouble concentrating, fatigue, and sensitivity to odors. This means that the poor building conditions may raise those symptoms. The risk of contracting infectious diseases transmitted through the respiratory tracts, such as COVID-19, can increase in a poorly ventilated room. Lower the risk with regular filter changes, opening windows, and covering coughs and sneezes with your forearms. Dry eye syndrome. The lack of humidity in air-conditioned spaces can dry your eyes. This can make them irritated and itchy and may even make your vision blurry. Also, rubbing your eyes with contaminated hands can lead to redness or infection. It is important to note that COVID-19 can also be infected by rubbing your eyes with hands contaminated with the virus. Respiratory diseases. Studies show that people who work in air-conditioned buildings have more respiratory problems, such as runny nose, sneezing, rhinitis, and stuffy nose than those with natural ventilation. Skin aging. The lack of humidity in air-conditioned spaces can dry your skin. If repeated, this can lead to skin aging. In particular, blowing air from the air conditioner directly on the skin can accelerate skin aging. Humans can adapt to the climate. If exposed to a specific climate for a long time, the body can adapt to the climate and live without much discomfort. However, as heat waves frequently occur perhaps due to climate change, people tend to avoid the heat entirely by relying on air conditioners. Spending more time in air conditioning makes it harder to deal with hot temperatures. The more you hang out in spaces pumped full of air conditioning, the less comfortable heat and humidity you will feel. As humans age, their ability to respond to high temperatures decreases, making them more sensitive to heat. Therefore, it is necessary to develop the ability to adapt to high temperatures rather than relying on the air conditioner. Even if you turn on the air conditioner, ensure no more than 5 degrees Celsius difference from the outside temperature. We need to develop the ability to fight against the heat when younger. This was Dr. Sang Il Jun in Public Health. Thank you for watching.